Governor Mike Pence has announced a new plan to help Hoosiers who are mentally ill. 13 Investigates has been exposing how Indiana families dealing with mental illness have often nowhere to turn for help. Good evening, everyone. I'm John Stair.
And I'm Andrea Moorhead. Our senior investigative reporter Bob Siegel shows us a brand new state hospital that could help hundreds of thousands of Hoosier families.
I'm pleased to announce our plans to construct a new state-of-the-art mental health hospital on this site that will be opened by the year 2018.
Today, the governor formally unveiled a project that's been in the works for almost a decade. It's called the Neurodiagnostic Institute and Advanced Treatment Center, a 7-story, $120 million state hospital to diagnose and treat the mentally ill. It will be located on the east side of Indianapolis, alongside Community East Hospital, and it will become the state's flagship mental health hospital for all Hoosiers dealing with mental illness.
This hospital is for the entire state of Indiana.
Dr. John Wernert runs the state's Family Social Services Administration. He says a new state mental hospital is desperately needed and long overdue.
We've allowed patients oftentimes to go many years either improperly diagnosed or not receiving the appropriate treatment. What this institute will allow Indiana to do is move forward into the 21st century.
A recent Eyewitness News investigation showed 70,000 children in Indiana are dealing with mental illness. And across the state, their families simply cannot find treatment for their mentally ill children.
We can't get our child into a facility where he needs to be.
I need a place that's willing to give my daughter a chance to get better.
The new state mental hospital will have 159 beds, and 42 of them will be set aside specifically to help children and adolescents. It will actually replace the LaRue Carter State Mental Hospital. That facility is more than 80 years old on the west side of the city, and it will soon be phased out. Mental health advocates say the state's new investment in mental health is very unusual.
It's a rare situation that Indiana steps forward in the area of mental health and addiction. Getting a diagnosis, getting appropriate treatment, coordinated with physical care, that's exactly what we should be doing. We've never done that. We're very excited.
The new hospital will have 10 suites to provide what's called telemedicine or telepsychiatry, meaning a patient in Evansville or Elkhart could get help from the hospital without having to actually travel all the way to Indianapolis. Construction will begin in the spring. State leaders say the hospital will be open sometime in 2018. Andrea, back to you.
Bob, thank you.